Hello and welcome back to Midlife Rises. I'm Cheryl. I'm sitting here with Dr. Cherry Ostrager from Midtown East Family Medicine PLLC. Dr. Ostrager is a family practitioner, but she specializes in back pain, allergies, and get this, mental health. If you looked at our past episodes, you'll see that I'm big in psychology because I really think we need to grow as individuals so that we can have coping skills in our adult life. So I'm going to sit here with the doctor for about 28 minutes. We'd like to invite you so that you can see what you can pick up. Remember, knowledge is power. Okay? So Dr. Ostrager, what exactly made you go into the medical field?
Well, my love for medicine started at a young age. I wanted to make a difference in a patient's life. I wanted to help improve their quality of life. I came from a strong academic background.
You mentioned that.
My parents were both teachers. They were very supportive throughout my career and throughout my years growing up. And they really emphasized education. That was very important. To be the best that I can be and to reach my fullest potential.
And yet you didn't choose being a teacher. You went into medicine. Why did you do that? Why
well,
medicine?
I think children tend to do the opposite of their parents.
Oh, that's true. Yeah, that's true.
But,
so what triggered it? What made you actually decide, hey, I want to be a doctor? What were you doing as a child that made you, decide that?
Well, growing up, the trials and tribulations of just being a child, going through high school and dealing with certain issues, you realize that there's a lot of problems out in the world that you as an individual can do better.
That is great. That is great, because the thing is, what I like about you is you didn't just do, because I know a general practitioner will just do general medicine, but you went the extra mile and you did it where you focused, you zeroed in on the things that we are actually suffering with, like we are having problems with in our lives, like allergies, as I said before, allergies and back pain and mental health. So let's talk about how you decided to consolidate, because as I understand it, when you're in medical school, you have different things that you test drive, and then you decide, okay, I want to be a chiropractic doctor, or I want to be, a nurse or a gynecologist. But you zeroed in on the things that you were interested in, and you consolidated it in that sector of being a family practitioner. How in the world, Dr. Ostrager, did you do that?
Well, it's really great to be a family practitioner. And why is that? Because you can do a little bit of everything. Initially, I practiced all aspects of family practice, but as time went by, I saw that a lot of patients, both male and female, would come in, all age groups, and they would have particular problems. And it was more frequent problems that were coming in with, such as allergies, back pain, and mental health issues. So I felt it was important that I needed to hone in and concentrate on these particular areas.
Back pain is an ailment that most people suffer from, and I'm very impressed that you focused on that, because that's one of the things I would say, or would you say, after 40, would you find that it's more rampant in people after 40, like middle age?
Well, back pain, I found that it occurs in all age groups, but particularly in patients over the age of 40, especially women.
You're saying it's mostly women that get
a lot of women over the age of 40, they're coming in with back pain. And it's important, before you make that diagnosis of the etiology of their back pain, it's very important to do a thorough history and physical exam. Because a woman comes in with vaginal bleeding and back pain, you have to think about fibroids. They can also, in that age group, over the age of 40, they can have osteopenia.
What is osteopenia?
Osteopenia is low bone mass. And as patients get older, it can be a genetic component, but they get a lot of back pain as a result of arthritis, osteoarthritis, degenerative joint disease, as well as rheumatoid arthritis is very prevalent in the woman over the age of 40.
Okay.
In addition, they tend to be sedentary, so prolonged sitting, prolonged standing. They work out at the gym, doing heavy lifting.
Are you saying at the gym that can also induce back pains?
Absolutely.
How?
Because they're lifting heavy weights and they're putting a strain on their back. And they can also induce a herniated disc.
Oh my gosh, herniated discs can be caused by working
Very
out at
common,
the gym?
yes.
Oh, you're
Women, they may be
kidding.
moving from one apartment to another. At that age group, they can have young children. They're carrying a heavy child.
Just
Yeah.
this is crazy. I cannot believe it. So what is your advice to fix something like that so that you're not a candidate for back pain?
When a patient comes in your office, you have to do a medical workup, do some lab workup.
Yeah, I was seeing that you do thorough stuff like that. That's good because a
Exactly.
doctor is always ready to write a prescription, and I was looking at how you go about it. You actually dive deep in to make sure that you
Yes.
get all of the underlying conditions before you start treating it. Tell us about that.
Well, when women over the age of 40 tend to be more sexually active.
Yeah.
Yeah.
Okay.
A lot of women that come in with back pain, you have to rule out urinary tract infection, a pelvic infection. You have to rule out sexually transmitted diseases, especially
That can cause back pain?
fibroids if they're coming in with the vaginal bleeding, as I just mentioned before. Kidney stones in women over 40. So all these things need to be ruled out. And you get the thorough history physical exam. If they have a history of heavy lifting, then you know you need to do an x-ray, possibly an MRI, to rule out a herniated disc. Then you would look into maybe a possible referral to an orthopedic
I
surgeon.
saw that you did that. So you're connected with high-end clients in that
neurologist,
area. Yeah.
and eventually pain management is very important.
Would you say you're in line with a chiropractic doctor where they can see you and be comfortable, and if it needs be, then you transfer them to a full-fledged chiropractic
I'm not a
doctor?
chiropractor, but I do have a strong background through my training in osteopathic manipulative therapy, which comprises a bunch of different techniques for back pain. But also you want to refer them for physical therapy is very important.
That's if it's out of hand.
Yes, to strengthen the muscles around the area of concern.
So you're not cracking the back. Me personally, I don't like the chiropractic doctor. I feel like they're breaking things. You know what I like doing for the back? Like I lay on the floor and I do the pelvic rock because I know that helped me during my labor sessions.
Yes.
So the pelvic rock seemed to help.
Yes.
Does it? Would you say?
Yes.
Okay.
And actually that's a type of osteopathic manipulative therapy, the pelvic rock. There's also other therapies. I don't do a lot of osteopathic manipulation, but for the low back and for the neck, and specifically for sciatica.
Oh, that's
there's
huge.
certain-
That one,
yeah,
I
there
think
are
my
certain
brother
techniques.
and that's painful, the sciatica.
Yeah, very painful.
What causes the pain with them?
A lot of times it's pressure on the nerve. So that's why it's important to also do neurological studies to rule out neuropathies, radiculopathies, and polyneuropathies.
Jesus, listen to these terminologies.
So, and if you see, that's where neurologists may come in play. Sciatica is very common in women over 40. They come in with low back pain and it's radiating down one or both legs. And it's very painful and it's very debilitating. So what does a patient do with sciatica? They need to come into the doctor's office and get evaluated, get a thorough history and physical exam to how long this has been going on, what makes it better, what makes it worse.
Is it hereditary? Or?
Well, there is some genetic component to it, yes.
Okay. Now, as far as the sciatic, you can have therapy for that to make it go away, or do you need surgery?
Well, the first thing, I always try to be conservative with my patients. The first thing I like to do is always maybe get them into physical therapy. But you also always want to get a baseline orthopedic consult and get his opinion on things. And then he'll prescribe the prescription for the physical therapy.
See, that's what I like about your office, because right now I help out my mother a little bit, and what I notice, a doctor sometimes don't even listen to your chest, and they're ready to write a prescription, but not you. You're taking that extra step to find out exactly what's wrong with the patient before you go ahead and prescribe, and I like that a lot. So tell me about the allergies part, because that is, I've never had it, but from what I'm hearing, you don't need to be suffering with allergies from childhood to have it catch up with you later on. How in the world is that possible?
Well, a lot of patients, they suffer with these annoying allergy symptoms. They're miserable and it affects their quality of life. All they want to do is sleep. Now, what are some of these annoying allergy symptoms? Nasal congestion, cough, watery, itchy eyes, sinusitis,
What is
headaches. It's sinus infection.
Sinusitis, that's funny. You said cough? Cough is part of an allergy?
Absolutely.
Really?
And there's a lot of symptoms. People don't even think that allergy symptoms, but they are. And you may be allergic to something, and that's what's causing your symptoms. They can have headache, fatigue, hyperactivity, muscle pain.
Oh, you're kidding.
Absolutely.
Oh my God, this is terrible. So you have to go to a specific allergy doctor for that, or your general physician?
At my office at Midtown East Family Medicine, I did training in allergy testing because I felt it was very important. A lot of patients, they go to the pharmacy and haphazardly buy antihistamines, not knowing what they're treating. So it's very important to identify what patients are allergic to. Now, what is allergies? Like, what causes allergies? Allergies is caused by an allergen that we're allergic to. And our body's response to this allergy is to produce histamine. And histamine is just a chemical that's produced by the body in response to an allergen that we're allergic to.
Years ago, we have relocated back to Trinidad. That's where I'm from originally. And my eldest son, I should say, I went and I brought back a lobster, very big lobster from Hilton. And he was fine with eating shellfish. And that day, I don't know what happened, but his lips just got gigantic. And from that day on, he would not touch any kind of shellfish. And he's saying that he's allergic. And I don't think he is. Do you think that was an isolated situation?
Yeah. So very serious allergies are shellfish, nuts, especially in young children. Nuts is a very serious allergy. Also, wheat allergy. Wheat allergy is very, very, it's a serious allergy. It's more serious than a gluten allergy and also celiac disease. So again, it's important to find out what a patient's allergic to, because a lot of these allergens, they can be in your foods, and you have the symptoms of headache. You're having dizziness. You feel
dizziness from allergies. That's
fatigue.
Interesting.
Another allergy is horsehair. Horsehair can be found in down pillows. So if you have headaches, nasal stuffiness is a big one. Removing the down pillows from your environment can alleviate your symptoms.
That's interesting. You were saying that you actually do that in-house, and people can get it within 15 minutes. That's huge.
Yes, we do. They come in with abdominal pain, fatigue, and these are all signs of allergies. And patients aren't aware. It doesn't have to just be the watery, itchy eyes and nasal congestion. At my office, I deal with pure allergen extracts from a very reputable allergen company.
Yeah, so you said that.
And I picked out my own allergens, and they're conducive to New York. So everything we test for, you can find them somewhere in New York, whether it's upstate or Long Island or
right. But you mentioned something about being specific to New York. What was that again? All of the allergies that you can have in New York?
So in my office, we check for trees, grasses, molds, weeds, animals, and of course foods.
You said rats before. Did you say rats?
Well,
I
rats
thought that
is
was
part
gross.
of the animal family.
Oh, okay.
So,
That is so
and that's
gross
very prominent in New York. So
Yeah.
it's very important. People have allergies to rats, and those type of things.
Okay, so basically, Dr. Ostrager, you're saying that you can treat someone in your office for as little as 15 minutes.
Obviously, everyone's in a rush. They come during their lunch hour. They're working. So we do it in as little as 15 minutes. We give same-day test results.
That's nice.
And treatment options are discussed.
Okay, so that covers the allergies situation. Now let's talk about the biggie, which is mental health. Now, you know, like I said before, people who've looked at our past shows, they know that I'm huge on psychology. I studied it in school and whatnot. But what I think is important is that we don't grow as individuals. We don't, I think that emotional intelligence should really be discussed as the ABC, because it's so essential to our growth. And a lot of people are doing the robotic thing, and they're growing into adults, and now you have all these different problems. And that is why I think you get a lot of anxiety cases and so on. So tell us about the mental health. What threw you into the interest of mental health?
Well, as an intern, when I started out my medical training, the hospital I was working with was also associated with a psychiatric hospital. So everybody coming in, they would have a medical diagnosis such as chronic obstructive pulmonary disease, hypertension, whatever it was. But they also had a psychiatric diagnosis because a lot of them came from the surrounding psychiatric facility. So I did get a lot of training at that point.
And that's what sparked the interest.
Yes.
Now, I started to talk to you about what I was studying and stuff, and we talked about the sympathetic and the parasympathetic system, and that is basically when you're calm, you're in the parasympathetic mode.
Yes.
So that anxiety thing, because I know you said you're not a psychiatrist, but I think it's huge that you're doing mental health, because as a woman, I think you can, like you said, hone in on certain things that women themselves are having problems with, and that is like a big one, the anxiety. So for me, I've had episodes of anxiety. I think when you get into overload, which is that flight or flight, that is what I had my episodes with. And I think women overall, when they get to the age of 40, which is a high percentage of your patients, we start to do the competitive thing, and we're competing against ourselves, we're competing against one another, and just the whole society thing, you know, the rush they're putting on us to be married at a certain time and to have a career at a certain age, all of those things set a stage for anxiety. So tell me about that. Tell me about what, you know, cases you've had in your office.
Well, a lot of patients come in and they have anxiety and depression, but what's really important is to be a caring, compassionate physician and listen to a patient's concerns. So when they come in, you have to ask the appropriate questions, which are, do you have any anxiety? Are you having panic attacks? When did this start? How long? When was your last panic attack? Are you having thoughts of suicide, ideation, or intent to commit suicide? Are you having crying episodes, sleep difficulty? Are they waking up in the middle of the night? Are they having problems falling asleep? And loss of desire to do the things they enjoy?
That's depression,
so these are the questions you need to ask, because a lot of patients that come into my office, they do not divulge this information, and they kind of suppress it. So it's very important to ask that. And once you get that information, you see they're having anxiety, they're suffering with depression. You need to find out the etiology. Now, before I even jump to starting them on medications, it's always good to go for therapy. The first thing I want to do is do a thorough history and physical exam and rule out any organic etiologies, such as thyroid disease. Maybe they have some cardiac etiology. You also want to rule out diabetes.
All of these things can cause anxiety.
Exactly. Hypoglycemia can make somebody very nervous and jittery. If they have thyroid disease, underactive thyroid, you could be depressed, and those type. And if you're hyper, palpitations, almost like you think you're having a panic attack, that could be overactive thyroid or hyperthyroidism. So it's really, really important to make sure they don't have an organic etiology or medical diagnosis that's causing their anxiety and their depression.
You talked about ADHD, is that?
Well, a lot of patients have ADHD, and they may have had it when they were very young, and maybe it was misdiagnosed, or maybe they didn't have the support network to bring, maybe their parents didn't bring them to a psychiatrist, and they just really didn't treat it adequately. But they're suffering because they can't concentrate, they're easily distracted, they're hyperactive, and a lot of times it's disruptive during the college years when they go to school and they can't do their schoolwork. Then maybe they're at work and they can't meet their deadlines, they can't sit still at a desk. So that needs to be fully diagnosed and worked up by a psychiatrist, and then put on the appropriate meds if necessary.
You can identify those issues, though?
Absolutely.
Or you can?
Yes.
Okay. Because I know you were stating that sometimes successful people, they're going about their everyday lives and they're suffering from this thing. And is it that they know about it and they don't want to identify it, or they just don't know which way to turn?
It could be that. Well, it could be they just they were never really adequately
That is
diagnosed.
absolutely crazy.
Yeah.
And you know, people are successful and they're just not happy. And this goes, you know, it trickles back to that emotional intelligence, because if you're able to identify with your personal feelings,
Sure.
then you can tell exactly what's going on with you.
Yes.
But let me tell you, I'm excited. I'm just so excited because here you are as a female doctor.
Yeah.
And you're not just seeing females, you're seeing men, women. I know you're not a psychiatrist, so I'm not going to talk about bipolar and so on,
Yeah.
but we can cover things like
Sure.
depression and anxiety, right?
Absolutely.
Because that anxiety is tearing us up. You get into overload, and depending on your diet, you know, it's like the perfect storm.
Exactly.
With it mixing with sugar and inducing the adrenaline and the
Sure.
whole vicious cycle. So as far as anxiety, what actually causes anxiety?
Well, a lot of patients, they come to me and they can have anxiety from work, the work stress associated with a very demanding boss, and they have to meet deadlines, so that causes a lot of stress. Also, it could be someone who just moved here from another state and they're a transplant.
That's more low-key.
Yeah, so it's a lot of stress for them to acclimate to New York. It's very stressful for them. In addition, it could be something going on in their relationship, whether they're married or whether there's a significant other. So it could be stress related to that. They're in an abusive relationship, or maybe
Even a
they're not
loss or a
happy.
death.
Yes, exactly. So a lot of patients also, they're in midlife and they get to this point where they're maybe in their early 40s and above, and they're saying, where am I in my life? Am I really where I want to be in life? And they feel like they haven't really reached their true potential. Maybe whether it's at their job, in their social life, or whatever it is, and they just start having a lot of anxiety.
Midlife
And
crisis.
they get depressed, they have anxiety. So a lot of those patients, once I rule that in the organic etiology, I'll refer them for therapy. I'll also start them on some medications, antidepressants.
Let's talk about that. What kind?
Using the SSRIs, they do pretty well. There's Lexapro out there.
What is SSRI?
Serotonin reuptake inhibitors. This is a class of medication.
By the way, that is for your balance, for your comfort, you know, to just be happy. That's your happy senses.
Exactly. Okay. But so they do pretty well. I have a lot of patients on different medications, and so they take that daily, and they also go to therapy, which is very good.
You talked about
And
Lexco. What are the different kinds of medications and what kind of effect it can take? Because you were talking about one that can affect your liver and stuff like that.
It can affect your heart, so it's very important before you start anybody on any of these antidepressants is to get a cardiac workup, and just make sure they don't have any underlying heart disease. A lot of these medications can affect your liver, so obviously you gotta monitor their liver tests every so often. And they do pretty well on that. Some of these medications you gotta be careful because they do cause weight gain, and obviously as females we don't like to gain weight. But from a primary care point of view, basically I just anxiety, depression. When it gets into bipolar and more advanced psychiatric diagnoses, then I usually have them referred to a psychiatrist, or if they're on 2 or 3 medications at that point.
I am telling you having these these 3 things, and I know you said you have patients from 16 and up.
Yes.
But you having the background that you have within those 3 things that bother us in midlife, like your back pains, allergies, and mental health, that is huge. And I'll tell you what's big about it. You're a female doctor.
Yes.
I mean, you said that men don't like to discuss things. They can open up to you because you're a female. And then females, one-on-one, you don't want to run to a psychiatrist because we know they medicate. I mean, a psychologist, to get one, how easy is it? So you having those skills are huge. And I'll tell you what else is big. The fact that we can discuss menopausal symptoms. Let's talk about that for a minute. You said that anxiety can also come with menopause, like the...
Absolutely. When you approach menopausal years or premenopause, a lot of times you have difficulty sleeping, you get the hot flashes, you get anxiety, you can get all these symptoms. And usually a lot of these symptoms, they start 10 years prior to when you go into menopause. So
Really?
it's
10 years before?
Yeah.
Like, what kind of symptoms do you get?
Well, you can get the sleep difficulty and perimenopausal is usually hot flashes, irritability is a big one, anxiety, depression. So all these symptoms that could go along with perimenopausal or premenopausal. They may get their periods may be lighter, they may skip periods. But what the important thing is for these women is to know that there's options out there. And I think a lot of women don't know about these options. And especially if you're in your early 40s, your biological clock's ticking.
That's another thing we didn't talk about.
You don't have a significant other.
Right.
It's really
anxiety,
important to know your options.
The anxiety of not having children, that's another problem, right?
Well, there's other options out there. Obviously, you can freeze your eggs, so egg freezing. There's surrogates, there's egg donation. So if you get into the 40s and you still want a baby, obviously you go and you get the workup at an infertility doctor. But women have to know there's options out there. There's options for everything.
Right.
And they have to just be made aware. And there's people to help them.
And to be
and they
able
don't
to
have to
open
be
up.
depressed. They don't have to be have anxiety. And you know, the thing that's really important is quality of life for women. They have to know that, you know, they can feel better. They don't have to feel this anxiety. So maybe they have to go on a low dose of an antidepressant just to feel better. Then, you know, that's good. They should do that.
And there are natural ways. What are the ones that you would recommend? I mean, the
Well,
therapist.
obviously, you want to, you know, cut out the intake of alcohol. Caffeine makes you nervous and causes anxiety. Sugar, big one, sugar. So to cut out the sugar and those type of exercise, extremely important.
And meditation.
Go walk, absolutely. Yoga, acupuncture, and all these things are very important.
Natural ways, that's good.
Exactly.
So coming down to the end of our show, but what I wanted to really point out is Dr. Ostrager is what I would call jack of all trades, because she is a family practitioner, but more importantly, you can get down to the nitty-gritty with her and feel the comfort, because you can talk to her about menopausal issues, you can talk to her about childbearing, midlife issues, and it's not specific to women, but Midlife Rises is a woman's talk show. So of course I'm highlighting that area, but it's open to both men and women. Dr. Ostrager, I'd like to ask you one more question. What made you decide to open up your own practice, to branch out and go on your own? Because I know you're affiliated with Lenox Hill and Beth Israel, but what made you decide to go out on your own?
As a woman myself, I felt it was really important to have my autonomy and to be in private solo practice. And I felt I had a lot to offer these women and to help them with all their concerns and their complaints.
That's crazy. And you know, everywhere, like I've looked you up and in your testimonials, all of your patients are saying the exact same thing, that they can talk to you on a normal level and that you show empathy and so on. So that is big. That is real big for a doctor. You know, so I would like for you to check out Dr. Ostrager's website. She is conveniently located in the Midtown area on East 57th Street. You want to give them some more information on your
Well, you should check out our website. Site address is www.midtowneastfamilymedicine.com. We have a news section. We talk about all the type of issues that come up each month, and we talk about all the important issues that women can, you know, they deal with and they can get information about.
And your office hours are you're here
very
sometimes at
flexible office
7:30.
hours. Yeah, sometimes we come in here at 7. So we're flexible with our office hours, and I try to accommodate all the patients because they have busy lives, and you know, to make sure they're able to come into the office, even Saturday hours.
That is crazy. You're just so open and so flexible. I think that's why you stand out from the others.
Yes.
So anyway, we're coming down to the end of our show. Dr. Ostrager, thank you very much for taking the time. And do check her out, okay? I know that you will be completely satisfied. So thanks again for joining us. We hope that you enjoyed our piece, and we will see you next time. Okay? Take care now. Bye.